Hello and welcome back to the Courage Sessions. Today we are very, very thankful to have some colleagues joining us from the AAMC who manage the Mcat program. We've got some great questions lined up for them in regards to some of the big changes that have happened this year with Mcat. But just to welcome you today, my name is Enrique Hasa and I'm the Associate Director of the Texas Health Education Service here in the TMDSAS office in Austin, Texas. And joining me today, we have two folks from AAMC. Ileana, would you mind introducing yourself first, and then Dr. CRC?
Absolutely. Thank you so much, Enrique. My name is Ileana Esteves, and I'm the Manager of Outreach and Engagement for the Mcat team. I'm very excited to join you today.
Thank you.
And I'm Cindy Searcy. I'm the Senior Director of Research and Development at the Mcat program. And we're just grateful to be able to be a part of this program. So thank you.
Absolutely. And thank you both so much for taking the time to join us today. As we all know, there's so much work to be done right now. And so I thank you for taking an hour to take some of the questions that we've heard from our students and from our advisors. But if you have any questions joining us today, I will be moderating questions to bring to our panel today. So please do feel free to post your question in either the TMDSAS Facebook page or on the Texas Health Education Service Facebook page. So just to kind of get this out of the way, I do know that you all are in the same space as MCAS, and they're obviously very busy with application processing right now, but I wanted to offer an opportunity to kind of quickly go over some of the changes that AMCAS has faced this year due to COVID-19.
Yeah, so I'll take that. I'll tell you what I know, and then I think there's a lot of information on the AMCAS website if people want more detail. So I think there are four main changes that AMCAS made in response to COVID-19. So the first is that they delayed the transmission of applications for AMCAS applicants to medical schools that use the application service, the AMCAS service. So they delayed the transmission of applications by about 2 weeks. So normally those go out at the end of June, and they delayed them to July 10th. So there were a lot of things that went into that. You know, they got input from medical school admissions officers and the pre-health community, and really tried to strike a balance between the extra time that applicants might need to fill out their applications. It's a lot going on, and things are sometimes harder to come by this year, but also medical schools processes and how to strike that balance with everybody's needs in mind. So the 2-week delay gave a little bit more time for applicants, and then medical schools have the ability to continue tailoring how they set up their timelines and review processes based on their own internal procedures and the number of applications they get and the number of people involved. So that's the first change, to build in some flexibility. Another thing they did was meet with the Association of Registrars to really understand how grades would look different this year from normal. So they could develop resources for both the applicants and the medical schools about what these different GPAs, mostly pass-fail grades and courses that are required and used to be all required grades, what that would look like in the transcripts and in the GPA averages that would go to medical schools. So they developed resources and had webinars for medical schools and applicants, and that's all available on our website. So that was another thing early on. They also did some things to create more ways for transcripts to come in, secure email and faxes, if faxes still exist, to go along with the ways that already exist, because colleges and universities, some of them couldn't mail transcripts the way they have in the past. And then finally, the AAMC expanded its fee assistance program. So prior to this year, applicants earning up to 300% of the federal poverty limit for a particular family size are eligible for the AAMC's fee assistance program. And this year we expanded that to allow more people to qualify. So now it's 400% of the federal poverty limit. And I think that that change is important. So last year at this time, there were about 6,300 applicants who had, at this point in time, qualified for the AAMC's fee assistance program. So 6,300, and now it's almost 11,000. So that's like a 70% increase in the number of students who are served by that program. And the other thing I'll say is that they introduced an appeals program so that if someone had applied for the fee assistance program and then their family circumstance changed because of the COVID-19, then they could resubmit information to be reconsidered for this program. So those were all important changes to help applicants during this just really, really awful time.
Excellent. And we will definitely talk more about the fee assistance program a little bit later. Thank you very much for outlining those. And now to kind of get into the nitty gritty about Mcat. What changes were made to the Mcat testing plan this year in response to the COVID-19 pandemic?
Yeah. So in late March, when we had to stop testing, we canceled 8 dates between late March and mid-May. And we had to come up with a way to resume testing. And we had two goals, really. The first was to test safely, to allow for social distancing and ensure that health and safety protections are in place. And the second is to increase the number of testing opportunities so that students who want to test can, and that they can change their plans, because we knew we wouldn't be able to predict the course of the pandemic. So I'm going to start by talking about the ways we increased flexibility and then come back to health and safety. So the first thing we did is we looked at ways to add more seats. So we added 50% more seats than are available in a typical year, and really think about those 50% more sandwiched between June and September, right? So we added 3 additional dates, June 28th and 2 at the end of September. And then we created 3 sessions per day so that we could have enough seats so that examinees who were scheduled in those dates that were canceled, as well as others who might need to schedule and reschedule, had ample opportunity to do those things. And in order to test 3 times per day, we had to shorten the exam. And we can talk about that. We also, for flexibility, looked at how we could make score reporting more rapid. So normally it's about 30 to 35 days, and we worked on procedures to report scores within about 2 weeks. And that was super important for the 2021 applicants who might be testing later than they'd planned to get their scores as soon as possible. We also, in addition to the fee assistance program that we talked about, we eliminated all rescheduling fees and cancellation fees. So rescheduling is important because a student might plan to test and then things happen and they need to change their plans. And we wanted money to not be a barrier to that ability to change their plans. So the available seats and removing those rescheduling fees were important for that flexibility. And then because many examinees use our free and low cost preparation resources, we also extended all subscriptions through the end of the year so that as students' preparation plans change, they could access the same resources they'd been planning to access for their earlier test dates. So that's flexibility. Then if we think about health and safety, when we suspended testing, the AAMC and our test delivery partner, Pearson VUE, worked with medical education experts and infectious disease experts to come up with a testing plan. It's a 7-step protocol that is designed with redundant protections to ensure that examinees could test at testing centers with minimal risk. So it includes things like students, when they arrive at the testing center, must be able to attest to a set of conditions that says that they're well, they haven't been around people who have COVID, they're willing to wear a mask, things that ensure that they are able to comply with the requirements at the testing centers. We also reduced by 50% the number of test takers who are allowed in a testing session at one time. So social distancing is an important part of this testing safely. And so you imagine a testing center that maybe normally a typical center has 15 seats, and every other seat is unoccupied. The seats have partitions between them all the time, not just as part of COVID. And that is really designed to help make sure that students are separated while they're testing. Masks are required of everyone. And there are also sneeze guards and partitions between test center staff and examinees during the check-in process. And there's lots of cleaning and sanitation that are a part of this. Every examinee has the right to know that we're doing everything possible to ensure a safe testing environment. We have these protections in place, but students must feel safe at the testing centers. So we also have a program to help us evaluate how well we're adhering to those safety protocols. We have independent monitors we've engaged to do some secret shops. So they go posing as examinees to follow checklists to let us see if test centers are following their protocols. Every center has video monitors, both in the common areas and where students are seated when they're testing. So we can review videotapes of every reported concern of health or safety. We have a strict follow-up process for these reported health and safety violations. Senior AAMC management staff who review every other week to take in all this data and make decisions, and they have the authority. We will not administer the Mcat at test centers that cannot comply with these protocols. So we continue to review and reassess and adapt, but these are the things that we put in place to tackle the safety side of our testing plan.
Thank you so much. Those are quite a few points. I do want to ask some follow-up questions on a few of those. And we'll definitely get into the shortened test and the quicker reporting turnaround times. But as far as the safety at the testing centers, you mentioned that there's a set of conditions that students agree to. Would those happen to be posted somewhere online so that students can take a look at those?
They are. You can find them on the AAMC's website. We have an expanded health and safety page that if you go to the Mcat coronavirus section, you can find it. And it also is available on the Pearson VUE website. So there's a link to it. Recently, we did expand the website with a lot more detail about health and safety at our testing centers. It includes a diagram of a typical test center.
And I'm going ahead and sharing.
Yeah, oh, super. I didn't know you could do that. Lovely.
Scroll down.
Yeah, thank you, Ileana.
And so here we have health and safety, all of the different precautions that you outlined, including the health requirements.
Yeah.
So students can click on here and take a look at the certification that each student has to attest to. Now, if somebody, looking at a scenario where somebody is, it's the third time that they've had to retest, and they wake up the morning of their test and they don't quite feel well. And we're getting pretty late in the cycle of available test sites or just overall test availability. How can we make sure that that student feels confident enough to stay home without putting in jeopardy their application?
So that is super important. I'll tell you some things that I know, and then I'll invite Ileana if she has additional. So first of all, if an an examinee wakes up and they're not feeling well, they can contact us and receive an emergency refund. And even if they're not able to reach a human at that moment, that's not an issue. So we will resolve that part of it. So that's important for examinees to know. We will also work with examinees who are unable to test. I think one of the things that's really important is this extra capacity. In many regions, there are still seats available. As we reach the the close of the testing year, and we have so many examinees wanting to test and applicants to get their scores. Capacity isn't as great as it used to be, but there are seats available. And the other thing is, if an applicant or examinee finds themselves in that situation and they contact us, we will work with them to see what we can do. So we're here as a resource, and it's important. We understand how important these scores are to these applicants. So I'll ask Ileana to fill in anything I missed about how we can support applicants so that they feel like they can cancel their exams and still be able to test if they're feeling unwell on test day.
I think that one of the main messages that we want to communicate examinees is that their health is the most important priority for us and for them. And they should feel empowered to make the decisions that are going to ensure that health and safety for themselves, but also for others as well. In terms of the options that students may have, obviously, as Cindy mentioned earlier, we've worked very hard to create the flexibility within the plan to allow for rescheduling and also to allow for the unforeseeable cancellations that would happen given the pandemic situation that we're all encountering. But obviously, as we get closer to the test, the end of the testing year, that flexibility will shrink, especially depending on different markets. We always typically have markets that are sold out across the testing year. And so those options will narrow, but we do want to encourage students to make sure that they use the notification tool, the appointment notification tool on the Mcat, on the MRS system, so that they can be notified when appointments kind of become available, because in the same way that they may need to reschedule, other students may also need to reschedule, and that would inevitably open seats in other positions. And so, but we really do want to encourage students to really make sure that they don't feel pressed to take an exam and compromise their health. I think we all, in the same way that we're all responsible for wearing a mask and making sure that we've all followed on a daily on our daily lives, these health and safety precautions. I think we should take that and extend that also when you go into a test center and enter an exam. And so we do want to make sure and emphasize that students feel comfortable and feel that they understand that we also know the realities of what they are facing. And obviously that we are monitoring this. We have an entire team, probably more people than they think we do, monitoring issues of capacity, health and safety, and really being very thoughtful about how we can help and accommodate them and really support students who are interested and who want to test and who want to apply. Because at the end of the day, there's nothing else that this pandemic has shown us all is the need for health first responders, health care workers, and physicians. And so we want to make sure that we support that mission.
Yeah, thank you. And I think it's also important to note, it's been quite the eventful summer. It hasn't just been, just the global pandemic, but also there have been cities that have gone into curfews that have warranted the necessity to cancel test dates. There have also been natural disasters such as hurricanes in Puerto Rico, South Texas, just so far this cycle. So there have been just so many different disruptions. And when we're looking at Mcat, it's a global initiative for testing. So what you all are looking at is not just what's going on in the United States, but also what's going on globally. So I really appreciate your insights with all of that. Just one last follow-up before we get to our next big question. Looking into your crystal ball, would you happen to know if there are any discussions for extending this year's test cycle or starting next year's test cycle a little bit earlier?
We have a pretty big team thinking about how to manage the end of this year, as well as thinking about what next year will look like. So I can tell you what I know so far, but it's kind of a work in progress. So we recognize that these plans we have the testing year ending on September 28th, right? But we don't know if there are regions where local health orders or governor's orders will cause testing to be suspended. And so we're working on plans to figure out how to take students whose exams might be displaced or canceled because of those local conditions and provide additional testing opportunities. So you can imagine the things we're looking at in concert with our partner Pearson VUE are additional testing opportunities later this year. They would not be like brand new test dates for everybody, really focused on those people who are displaced because of the current situation. So we're looking at options involving the rest of this year. Another thing we're looking at, but it's probably less desirable from the overall application cycle, is early next year. So we're entertaining all of these options to try to make sure that for the 2021 applicants, we're able to provide the opportunities to test, and also for those who want to retest, that will help them submit the scores that they want in their applications.
Great, thank you. So you coming back to your initial statement about the shortened exam, how do the scores from the shortened exam compare to a full-length exam?
Yeah, that's a good question. I'm going to tell you what we did, and then there's lots more on our website. So when we decided that the only way to provide enough flexibility and testing opportunities was to shorten the exam, we looked at how we could do that, but preserve its meaning. So we eliminated elements of the exam that didn't contribute to the total score. Right, so there's a tutorial at the beginning of the full length exam, and we made that, it's always been online so students could prepare in advance, and we really advertised to students that they need to go to the website before they show up on test date. There was an end of day survey and some other things we did, as well as eliminate those experimental or field test questions. So what we did was make sure that all of the scored items, so all of the passages and questions that contribute to the section scores and the total score, remain, so that we can test the same concepts and skills at the same level of difficulty, and also report scores that have the same precision as the full length exam. So students receive the same 5 scores, the total score and the 4 section scores, with the same confidence bands as they do the full length exam.
That's quite a concession, because those optional questions are largely what influences future assessments of the test. So that's quite a major concession, I think. Especially, you and I have definitely had a lot of conversations about Mcat validity, especially early on when the new test came about. So I do want to emphasize that that's a huge concession, knowing that those developmental questions are important for the further development of the MCAT. So how are the new quicker score turnaround times possible? It's pretty notorious that you have to wait a month or so for your scores, and so now all of a sudden we can get them back in about 2 weeks.
Yes, it's kind of like a miracle, but there are things that I can talk about and things that I can't, because I guess we could call them kind of trade secret, right? So there's a lot that goes into the 30 to 35 day score reporting turnaround. We allow time for examinees to report to us concerns about test questions or difficulties, either at the end of the exam, or report to us after test center concerns. And all of those require investigations in order to resolve them, so that when we report scores, they are fully resolved, all of the questions about them. So we made some changes changes operationally and also kind of recruited more resources to be able to manage those parts of that work a little bit differently in the short term. We also did similar things that I'll give less detail on for the scoring of the exam. We have this behind the scenes committee of external, internationally renowned testing experts that advise our program. They review what we do when we encounter situations like this. They provide guidance and plans for how we respond to that. And so we laid out a set of plans for how we would score the exams more quickly and reviewed them with them, and then had them look alongside us as we did it the first couple of times to kind of confirm that we had good sound procedures so that the scores that we report in 2 weeks have the same accuracy as those that take 30 to 35 days. This whole system we have right now, given the makeup of the exam, is not sustainable. Just like the developmental items, they're critical for the long-term viability, but we felt like it was important to report scores more quickly this year because of these extraordinary circumstances.
Thank you. So you've alluded to this already, but how is the new revised testing plan affecting EY 2021 applicants?
Yeah, well, the obvious details are that students applicants tested, many of them later than they had planned to. So think about applicants, a lot of applicants test in the spring when we had to cancel those 8 test dates, which so many people are testing or retesting later than planned. And that's kind of why extending the subscriptions for the preparation products was so important, to let them continue preparing. It's also important, and we emphasized this year more than ever, that including information in their applications about their future test dates so that medical schools they're applying to know and have that signal, oh, I know another score is coming. We also, because we added this extra capacity concentrated from June through September, we're testing a lot of people right now. So since testing resumed, we've tested almost 50,000, we've administered almost 50,000 exams. And so for the year, we're at almost 65,000. The last 2 weeks alone, we've administered over 10,000 exams. There are about 5,000 people testing tomorrow. And there are 45,000 exams scheduled for the rest of the year. The expedited score reporting is important. So in the next 2 weeks, over 11,000 scores are being reported. And those are for people who tested between July 31st and August 8th. And so right now, with this steady stream of testing and quick turnaround, lots of applicants are getting their scores. And really, the key dates are thinking about, especially between now and September 1st, although applicants are testing through the rest of the year. So don't get me wrong, it's important to remember there's a whole testing cycle for a reason, but we have a large percent of applicants testing right now.
That's quite the impressive number. So how are the medical schools adjusting to this new normal that, test scores are coming out a little bit later than usually planned?
Yeah. So as I mentioned earlier, we took a lot of input from the medical schools in figuring out what was the right amount of delay for the AMCAS applications being transmitted to schools. So they had input in kind of our cycle for submitting or transmitting applications to them. Medical schools have updated information in MSAR throughout this whole year as they've continued to make changes. So I'm going to talk first about their policies for score use. Many medical schools made the decision to accept scores taken later in the year because the test dates go on through the end of September, where normally it's mid-September that testing is done. So that was more than half of medical schools now have accept scores through the end of September. Some, in the hopes that maybe we would continue extending the year, allow scores all the way through the end of the year, and some even into next year. So it's really important to go to MSAR to look at medical schools' policies for accepting scores. And it's free. Those reports have been made public and open access, so you don't need to pay anything to see what schools' policies are in COVID.
Would you mind
Yeah,
giving us
yeah.
what MSAR stands for?
The medical school admission requirements. So it's a resource provided by the AAMC so that applicants can go in and look at details about each medical school and their requirements and the characteristics of applicants who apply and are admitted.
Thank you.
Another change was medical schools, many decided to accept older scores than they normally would. It's pretty common for schools to say, if it's more than 3 years old, we won't look at it. And so some made it 4 years old. Some said, any score from this exam we will accept. So that was just another type of flexibility. And then other things they did that aren't like limited to scores are adjusting their application deadline. So pushing back when they start screening or interviewing. Some schools are screening without Mcat scores or interviewing without Mcat scores. And then a few have decided that Mcat scores are optional for this year during the COVID-19 pandemic. And so I can't emphasize enough, MSAR has a wealth of information that's publicly available. It's a subscription service for some of the information, but this information about schools' flexibility in the middle of this pandemic are free and open access.
Great, thank you. And we'll definitely get more into MSAR when we talk about the fee assistance program in a bit. So how does this year's number and percentage of applicants who have scores compared to last year or even previous cycles?
Yeah. So, but I'll just be clear. I have a lot of access to data from the AMCAS application service. So those are the numbers I'm going to report. The numbers so far sort of are interesting. So let's start with the number of applicants. There were a lot of questions about whether applicants would decide to hold themselves back from the cycle because of just this crazy, terrible time. But the numbers of applicants are comparable, a little higher than this time last year, which surprised us, but there could be a number of reasons. So this week, there were more than 45,000 AMCAS applicants who have completed their applications. So they've said we're done and they're either already to medical schools or having their transcripts verified. And last year at this same time, it was about 40,000. So about 5,000 more applicants this year at this time than last year. Of the applicants this year, about 89% of them have scores. And that's compared to 97% last year. So a smaller percentage have scores. They may not have the scores they want, right? Retesting is an important part of the application process, but that is one benchmark. But in terms of the raw numbers of applicants with scores so far, it's actually about the same as last year. It's just that there are more applicants, which is partly driving that percentage.
Yeah, and we're definitely seeing the same trend with TMDSAS. We had a meeting with our TMDSAS medical schools, and we've actually looked at special populations like our non-traditional students who come from low socioeconomic backgrounds, students who have identified themselves as underrepresented in medicine. And all of those groups have actually seen a pretty large uptick, not just in applications, but in applications that have corresponding MCAT scores. So we're definitely seeing something very similar down here in Texas. So I do want to make sure that we talk about the fee assistance program. That's a really helpful service that AAMC provides for students. And we've talked about it a bit more, or a little bit earlier, but Ileana, would you mind walking us through what the fee assistance program encompasses?
Absolutely. So as Cindy mentioned earlier, the fee assistance program was developed to support students who would not have the financial resources to either take the MCAT, prepare for the MCAT, or apply to medical school. The goal of the program is really to take away some of the financial burden that a lot of SES students, low SES students encounter during the process of preparing and applying to medical school. The program itself, some of the benefits that Cindy also alluded includes reduced registration fee for the MCAT, includes free, completely free online preparation resources. So the students would get the complete online bundle with all of our online products. That includes full practice tests, as well as all of our other online resources. It also includes a free subscription to AMSAR. It includes a free ANCAS application where the students can designate up to 20 schools and a number of other benefits as well. And as Cindy mentioned, the eligibility requirements usually was meant for students or individuals who were at 300% of the poverty level for a specific family size. It has been expanded to 400%. And we've also introduced a kind of an appeal process, especially this is in response to the COVID pandemic, to address the challenges that some people, and to really acknowledge the fact that we know that some students may have had and encounter financial hardship as a consequence of COVID. And so it could have been that your family or you yourself lost your job. And so you may not have qualified before, but you may now actually qualify. And so we have allowed that flexibility and provided that flexibility so that the students can take advantage and submit additional information that would allow them to explain how they were impacted and would allow this, the team that is in charge of the program to reevaluate their application and hopefully award it. The program itself, students have 2 years to use all the benefits. They only receive the preparation products once. But they have 2 years. And then the beautiful thing is also that it allows them to reapply, so they can reapply up to 5 times throughout their lifetime. So, and as I mentioned before, it's really one of those, if you have been in education, and I think we all know that, you know, having access to the financial resources to take advantage of some of these opportunities that allow you to you know, prepare for an exam or even register for an exam is really crucial for students that come from low socioeconomic backgrounds. And so that has been the reason and kind of the mission of the fee assistance program is to really fill that gap. We know that it is not enough because of obviously students' financial needs range and some of them require a lot more assistance. But that is the goal and the intention of the program. Before, I think Cindy also mentioned this, as of this time last year, we had awarded about 1,600 students had been awarded the fee assistance program. In comparison, this year, we have already awarded 11,000. So we have seen a huge increase in terms of the usage of the program, and we're very happy. That's the reason why we have the program. We want students to use it, and we want students to kind of take advantage of those resources. But happy to kind of answer additional questions that you may have to.
Yeah, sure. So I do know, you know, previous to this role, I was involved with a joint admission medical program here in Texas, which is a special program for economically disadvantaged students. And I do know that, you know, the fee assistance program was such a big help for so many of them, not just in reducing the cost of the MCAT, but also in accessing a huge wealth of resources that AAMC provides. And then in addition to that, many schools will actually recognize the fee assistance program recipients and offer either free or reduced secondary application costs.
That is also very true.
Yeah, I do know that is quite a burden lifted on so many students, especially, you know, when you're talking about applying to 20 different schools, you know, something like that could get quite pricey. So for fee assistance program recipients, I think it's a huge blessing for them. And getting access to those benefits. I do know that we talked a little bit earlier about, you know, MCAT preparation and getting access to those resources. have any of those resources changed in accordance to the shortened length of the test?
Do you mean have we shortened the practice tests to match the now shortened exam?
Yes.
No, the answer is no. So one of the reasons is, and Cindy, please feel free to jump in. But one of the reasons is students know, based on what we communicate about our products are also developed by the test developers of the exam. And it takes about a year to develop a full-length practice exam, because we do want to make sure that the exam itself mirrors the actual exam, and that it serves as a good benchmark for students to actually determine whether they're ready or not, or whether they're making progress to take the exam. And so that was, of course, given how swiftly we had to change and shift to accommodate the new testing plan. It was one of the things that we were not able to do. I think what we have from the preparation perspective, what we have encountered is that students can still use the practice exams at the full length to really practice, of course, content and expertise, and to address spacing as well. And I think what we have found based on the feedback that we've gotten so far has been that students have found it useful and have found practicing with the exams. Sure, it's not, probably they don't, they start with a kind of, or they, at the beginning especially, there was a lot of, we definitely receive a lot of feedback, which we appreciate. But yeah, I think what we have seen is that feedback has decreased in terms of complaining of why we haven't developed a shortened exam. And obviously, it's something that had we had the capacity and the bandwidth to do, we would have done it. But it's one of the things that unfortunately we were not able to accommodate. But Cindy, please, if you have.
Right.
Yeah.
And in any situation, the AAMC full-length practice tests are actually a really great resource for any applicant, even if they opted to go and get a third-party test prep that helps them with content. The AAMC test, I know, really helps students kind of gauge where they are in terms of the difficulty of the test, but also in making sure that their timing is as close as possible to the actual assessment. And so I'm glad that those resources are available to students in so many different ways. So, we alluded to this a little bit, but clearly this has been a year of many frustrating situations for students. We've had cancellations, we've had several instances where things have gone beyond anybody's control. And it's been very frustrating for a lot of students. And you mentioned that there's been some feedback, but are there any opportunities available at the AAMC level for students to be involved in advocacy for AAMC or MCAS or Mcat?
There are. I don't know, Ileana, do you want to answer this, or would you prefer me?
If you want to start, I can definitely.
Okay, sure.
If you have any gaps, which I doubt, but.
I'm sure. Okay, so I'll talk about 3 ways that students can contribute. One is they can go to the Pre-Med Resources Hub. They can sign up there to both receive information from the AAMC, and also it includes a calendar of events, so they can see ways to connect with the AAMC on different things going on. So the Pre-Med Resources Hub is a really important way to think about things focused on the pre-medical student. We also have a learner feedback panel. So that's a little broader than just focused on pre-med. It's been going on for quite a little while now, and it's a panel of pre-medical students, medical students, MD, PhD students, DO students, residents, and fellows. And they serve maybe 1 to 2 hours every month, and they provide input on things, either if we're developing new resources or have initiatives, and they're there to provide feedback. And that allows a broader view into the things and how things are developed and what might be in the work for the future. So they can find information about the learner feedback panel on our website, and there's also an email address, learnerinput at aamc.org if they want to email us. And then the third is about advocacy. So there are ways that students can get involved to advocate more broadly even than that on the behalf of academic medicine. So they can visit aamcaction.org to learn more about the opportunities to contribute to our advocacy work. Ileana, are there things that...
I think you cover everything. I think the only thing I would add is, in addition to all the different ways that students can join and provide feedback, I think there's also the traditional ways of, we do receive and read a lot of the emails that we receive. We do respond to a huge number of DMs, and we try to do that as fast and as swiftly as possible. And we try to make sure that the information is also available in multiple ways, so that the students have the opportunity to really technical issues. So the students have the opportunity to really get the answers that they need in a timely fashion. Obviously, this has been a very not traditional year, and we have struggled to keep up with the number of emails and DMs. But we have done. I mean, I can speak with the team that is on the front lines, and we're doing our best to make sure that all of the questions are being answered as soon and as fast as possible. And we've also done our best to make sure that the information is really available and updated on the website. And I know that one of the biggest complaints that sometimes students said is that they either cannot find it, or that information doesn't answer the question. And really, we have been very thoughtful about making sure that the questions are really addressing questions that we actually receive from students themselves, and that those are answered and compiled. It's one of the reasons why we kind of created the new COVID hub, so that everything is centralized and is easy to find, and the students are able to more easily navigate the content and really find the answers in a timely fashion, so that they're not just making sure that they're submitted an email here or there. But I think we're making a lot of strides in making sure that we're providing that information increasingly in a more timely way.
Thank you.
Inquiries.
Thank you. I had a technical issue where I shared the wrong screen, but I do want to make sure I share the correct one in relationship to the resources Dr. Searcy mentioned. We have the AAMC Learner Feedback Panel with the email address that she shared to contact the Learner Input Team, as well as the AAMC Action Group, where students can take part in advocacy. So I did want to make sure to share both of those resources, and my apologies for the technical issue. We are about a little over 10 minutes left with this current session. We do have a couple of questions that I do want to bring up to the group. The first one is from Hana Ali. Will the Mcat length and times go back to what it was previously this cycle?
Oh no. There's a dog in the background. The answer is that the shortened exam and the 3 times a day were limited to the 2020 testing plan. So with what we know now, the best information we have is that 2021 will look more like 2019 than 2020. But as we talked about a few minutes ago, we're really studying the context and the situation really carefully. So I feel like there's a lot of work to be done in the next couple of months to decide what the right path is and what the right testing plan is. So I would say it would be better to kind of flag this as a more to come, because I think it's important to study what happens in our country and with this pandemic and with what the community needs before we say with certainty what it looks like.
Thank you. We have another question from a student. I'll try to condense this. It has to do with special accommodations right now with the current assessment. she's asking, she has a very specific scenario where, she'd like to take the test in a separate room. And she says the current window for accommodations appears to be about 2 months. Do you happen to have any information on special accommodations or where we can direct students who have those kinds of questions?
I will say that for that person's situation, the best thing would be to contact folks at the Mcat program to try to work through the questions and getting the accommodations that they need and getting scheduled. I think that the process of, thank you, obtaining accommodations is highly individualized, so it's a little bit hard to have specific guidance here without the person's particulars and so forth. So you can go to our website, and we have folks working hard to get students with accommodations scheduled this year. Ileana, is there anything else you would add to that?
I think probably emailing the accommodations team. It's the best way to get a specific answer to our question, especially given in the contact information. That's it. That's the contact card. It has both email, phone number, and information when you can reach out and speak with a live human. And so that would be the best way to get answers to specific accommodation related issues, and from an expert in accommodations, because all we would be able to say is very, very general. I think you're muted, Enrique.
Oh, technology is great, isn't it?
It is.
So looking ahead, how do these changes to the MCAT testing plan affect the validity of MCAT scores and the use of medical schools using it to kind of identify predictive factors in performance?
Yeah. So I think that is a super important question, and I'll tell you the things we've thought about, but I think also kind of time will tell. So the MCAT is designed to measure those foundational college level concepts and skills in the natural, behavioral, and social sciences needed to be building blocks for learning in medical school. So even with the shortened exam, because we preserved all of the scored content, the passages and questions, those scores still test at the same level of difficulty, the things that the medical school curriculum, those first and second year courses, assume that students come in with some foundational knowledge. So in that sense, it's the same. But many things are different, and it's hard to say how they'll affect the signal that MCAT scores tell about whether students are ready or where they might need a little bit of extra support. So there are obvious differences in terms of students' disrupted learning, and not just disrupted, but then completing classes online, and in circumstances that are less than ideal, preparing for the exam, carrying stress, and for some facing personal tragedy. So all of those things are just disruptive. Some students had more time to prepare because maybe they were planning to test in the early spring, and then maybe it's June or July where they tested. And so that extra time for some might have been, and they can't go anywhere because we're in a pandemic. So that might be for some more time to prepare, and for others less, because maybe they don't have a quiet place to study like they would have if they were at school. So there's just a lot of individual differences in how these scores might look for students compared to a traditional year. And then the other thing that we don't know is what medical education is going to look like for a couple of years. We know that at many medical schools, some or all of learning is starting out online. that's probably going to change not just how they're learning, but how they're evaluated. And all of that goes into how good a signal, how strong this signal MCAT scores are of students' performance. So we think the foundation of the exam hasn't changed, but I think we'll have to study it to really have some data to answer those questions.
Well, thank you. We are caught up with questions that have come in so far, and I do have a little over 5 minutes right now, but I really want to make sure that we get to these questions about addressing inequity at the AAMC level. Could you talk to us about what AAMC is currently doing, even if it's just pointing us into different departments areas, and how AAMC is addressing inequities in representation among physicians? You know, we're always hearing reports about how, you know, Black men are really underrepresented in medicine, and it doesn't seem to be getting much better. And then we have reports about students who are underrepresented in medicine not quite being at the levels that they should be. So would you mind walking us through some of the initiatives that the AAMC might be working on right now on that?
Absolutely. So I can help you point in the direction of DPP, which is the department that is in charge of diversity policy and programs within the organization. They are the leads in terms of addressing inequities and equality across the organization, and have a number of programs and initiatives to address both the lack of Black males in the field, but also to support building and strengthening the pipeline. In addition to that, so I would say that is the main resource that I would like to communicate and kind of direct students to. But in addition to that, at the pre-med level, which is more where I am involved, I can share that you know, at the AAMC, we have been looking at inequities and access to building and strengthening the pre-medical pipeline for long before my time here. And I know that when we first chatted, I told you that I've only been with the organization for about a year. And so, so this has been work that has been begun way before my tenure. And so I'm going to talk a little bit about some of the programs that have been in existence to really help address access to pre-medical education and to really help support and increase diversity and support underrepresented students in medicine. So one of those, which is one of the programs that the DPP team manages, is the Summer Health Professions Education Program, where we work with medical schools across the country, as well as our foundation partners to provide a career enrichment program for students interested in pre-health fields. It's a 6-week career enrichment program where students are able to go in traditional times. This year was a virtual experience, but in traditional times are able to go and move into a medical school campus, have science enrichment courses, be able to take part in experiential learning opportunities, engage with admissions officers and professionals to really learn and develop the skills and really start learning what they need to do and how they can position themselves to be a competitive candidate when the time for application comes. It's a wonderful program, and I really highly encourage, especially freshmen and sophomores who are in that trajectory, to take advantage of the program. It's completely free. And so it's one of those, and it addresses one of those tenets that has been identified across STEM education in terms of making sure that individuals from underrepresented groups have access to quality enrichment programs and resources that allow them to get more closely to that specific career or content area than they would otherwise because of where they're coming from. So that is one of the programs. In addition to that, as we mentioned earlier, we have been very thoughtful around how we develop resources and preparation resources for the Mcat. Not only do we have our low cost resources, but we also have a number of free resources that are completely open to students because we know that even when you have low cost resources, that may be too expensive for students that come from extremely low SES backgrounds. And so we worked with the Kang Academy as well as foundation partners to develop the Kang Academy collection, which is one of the most popular resources. A year we have approximately 50,000 students that use that resource to prepare and review content for the Mcat exam. And we're always excited to see that students are taking advantage of that resource and are able to take advantage of the content that is there and use it to make sure that it helps them obtain and the score that they want and need to go into medical school. So that is one of the resources. And of course, we mentioned and talked about a little bit more in depth about the fee assistance program, which exists precisely that, right? So not just to address access to opportunities, but also lack of access to financial resources. So that is also another way in which we are trying to very specifically address some of those barriers that a lot of our underrepresented communities face. Also, other ways in which we support kind of diversity and inclusion and trying to really address some of the systemic barriers that we talked about is really by increasing access generally. So one of the ways, for example, which revolves around also financial access, but is the idea of how do you learn about and how the idea of visiting schools or learning about the schools and the admissions process. Not everybody has the funds and resources to go and visit schools and learn about the process. And so our pre-med team also conducts virtual fairs. This year specifically, we actually did 2 online medical fairs for students that are completely free, where they have the opportunity to engage with medical schools across the country to learn about their process, engage with the admissions officers, and really learn about how they can position themselves to submit a strong application. Again, really finding ways to make sure that students take advantage of the information that we provide in an accessible way, to make it really accessible for students so that they're not limited by the financial resources they may not have. And last but not least, I think the other ways that I think, so at the pre-med level and kind of from the outreach perspective, I think we're looking at it from a holistic way. We have a lot of programs and information that we've developed to address specific areas of the pipeline. And so we're always trying to think about how we can best make that more accessible and communicate it more clearly and make sure that students are taking advantage of our programs as much as they can, because if they don't take advantage of it, then we're doing something wrong. And so we do want to make sure that along with developing the programs and conducting those programs, that the word about those programs is getting out. So we have an outreach team that is in charge of making sure that that happens. And they travel across the country when that is possible to visit fairs and outreach events and really share information about all of our programs and resources that we offer.
Excellent. Thank you so much. I know we're a bit over on time, but I do want to make sure that we answer one more question that came in. And this might be more directed toward the AMCAS side, so I'll definitely address this from the TMDSAS side. But do you forecast a drop in volunteer hours for EY 2021 applicants? And I'll go ahead and jump in and say that absolutely. I think it's very much expected, not just in volunteer hours, but also in shadowing experiences, extracurricular experiences. I think, from discussions that we've had with our schools at TMDSAS here in the Courage sessions, the schools are very much expecting that and anticipating that because, the pandemic has really affected all sectors, particularly of healthcare. So I think for any students that are caught in a situation where, they've had experiences canceled, they've had volunteer opportunities that have been canceled or moved into different environments, I really want to challenge you to seek out new opportunities that you could volunteer through virtually. There are plenty of opportunities that are available right now that did not exist a few months ago. In Texas in particular, I can say that we've instituted telemedicine as part of healthcare. Texas was just approved when the pandemic started. And so that offers several opportunities for our students to engage with local physicians and see if there are opportunities for them to shadow in telemedicine situations. We also have, tons of great stories that have come out with, you know, community outreach and setting up food banks in your local community, you know, sitting down if you are somebody who knows how to sew, sitting down and creating masks for your community, particularly now as children are going back to school. And, you know, if you have a teacher friend who needs a good supply of masks, you know, there are plenty of opportunities right now. It's just being resilient with these changes and with those trends. Would either of you have anything to add to that?
I would say I agreed.
Yeah.
You know, it's one of the things that sometimes I know students want to make sure that they put their best foot forward and to have everything check off that list that they've been creating for a long time. And I think if there's anything that this pandemic has taught us is a little bit more humility and flexibility, right? Things are not always going to happen the way that we wish they would. And, you know, being flexible to those changes, but also no feeling like you have to meet that standard that you set for yourself, being a little bit kinder to yourself. And you know, I think if you explain that to any medical school in an application, they will understand. Everybody's trying to make do with, you know, with the changes that we have to accommodate to. So I think that there's a lot more flexibility than students may think there is.
Right. And now as we wind down this this courage session, I do want to offer both of you an opportunity to address applicants and advisors out there who are just kind of like floating around seeing what's going to happen. What advice, what words of wisdom do you have to offer them?
Cindy, I defer to you.
I think that what I hold on to every day is remembering we're all in this together. We're all doing the best we can in a hard situation with no right answers, and in fact, only a lot of like so-so answers. And just remembering that if we do it together, we'll come out all right. And I think for me, that's what I hold on to, and that's probably the best I can offer.
I think that's fantastic. Thank you.
Yes, I think I will add two things that have kept me a bit sane during this time. It's really flexibility and comfort with change. Really just not holding on too tight to like plans that you had developed long ago. So I think getting comfortable with change, which I know is not that reassuring, but it's a good lesson. It's definitely a good lesson.
Yeah, and those are definitely coincide really well with core competencies that we expect of our medical school applicants. So I think there's a lot that we can all learn from those. Well, Ileana and Dr. CRC, thank you so much to the both of you for your time today and your candor in sharing some of these questions, some of the responses to these questions. We know it's been a difficult year, and we really appreciate you taking the time to help educate our students and our advisors here.
Thank you so much for the opportunity.
Yes, thank you.